So the title of this webinar are Your Diet Questions Answered. So my wife and I, Dr. Alexandra Mele, are doing this presentation together. So we'll bounce back and forth between various slides, giving our different perspectives. Let's get going. So a little bit about us. We are owners of Aspen Integrated Medical Center. We specialize in naturopathic primary care, but we also offer many specialized services, such as deep tissue laser therapy. My wife specializes in craniosacral therapy, visceral manipulation. I specialize in hyperbaric oxygen, ozone therapy, and IV therapy. So Dr. Mele loves to see women, so women's health, hypermobility disorders, POTS, autoimmune disease, and many more things. I specialize in a lot of chronic pain, chronic infectious disease, such as mold and Lyme, men's health, and much more. One cool upcoming event for Aspen is I'm going to be doing some training with Dr. Schellenberger on prolozone injections. That's happening next week for me. I'm flying to Reno. And then we're going to start offering these joint injections. And I think this will really pair well with the deep tissue laser therapy because it allows me to help my patients avoid surgery, decrease pain, increase mobility in their joints. So all of this is about to avoid joint replacement and use less pain medications. So if you're curious of giving that a try, just give us a call and we will arrange you and put you on the schedule for that. So here's a brief webinar outline of what we're going to go over today. So we'll go over some general dietary concerns and questions that we commonly receive from our patients during our visits. Go over some specific diets for health concerns, general recommendations for fruits and veggies, protein, fat, and fiber, tips to improve your digestion, tips for successfully changing your diet, and then answer a couple other questions about vegan diets and then the benefits of intermittent fasting. And if you stick around to the end, you can ask all the questions you want. So we'll conclude with a Q&A. But I will say, if you have questions that come up over the course of this presentation, please just put a message in and I will answer those at the end when we're done. I'm going to hand this over to Dr. Mele.
Okay, so I just wanted to start with some general specific diets for certain health concerns. So we'll put in the preface that some of these can be done long-term and some should only be done a short period of time. And I will kind of say that as we come to each of those. So when we think of autoimmune disease, we have a couple of different diets that have been studied or shown to be effective. One of those being autoimmune paleo. There's some more specific information about this one on the next slide. It's a little bit more specific. It's very similar to Whole30, but it does avoid a lot of the more inflammatory foods. So things like eggs, nuts and seeds, nightshades, grains, those would not be included in an autoimmune paleo diet. The premise of this diet is really to focus on healing the gut lining, just so we're attacking inflammation from all sources. The gut is also a huge reservoir of our immune system. So getting that immune system in the gut modulated is a huge part of managing autoimmunity. The next one that's going to be helpful for a lot of different conditions would just be a general anti-inflammatory diet. So this is really focusing on lean meats, fish, oils, healthy oils, fruits, and vegetables. It's a little more simple to follow and a little bit more lenient than autoimmune paleo. Next would be Whole30, which has definitely become pretty popular in the last 10 years or so. Easy to follow. There aren't a lot of exclusions. Emphasis is on whole foods. So what do we mean when we say that? So instead of thinking about eating sweet potato chips, we're just going to eat the sweet potato. We want as many whole, unprocessed foods as possible with an emphasis, again, on the highly antioxidant things like fruits and vegetables. So when we talk about gut dysfunction, so gut dysbiosis, different types of bacterial overgrowth in the gut, whether that be candida, another fungus, or bacteria, These are the diets that really should only be done for a short period of time where we're focused on resetting the gut and doing gut healing. We don't want to do these over a long period of time. The first diet, low FODMAP, that one we don't want to do for a long period of time because it really does eliminate a lot of fibers that we need for different parts of our health. So low FODMAP, it's a really long acronym for, I only remember the first part, to be honest with you, fructooligosaccharides, a lot of other things.
I think the D's disaccharides.
Yeah. And those are things that are very high FODMAP foods are things like garlic, onions, apples, fermented foods. So a lot of those can contribute to gut dysbiosis or SIBO, which is small intestinal bacterial overgrowth. If we are eating a lot of those foods, or we've just become in an unbalanced place, or maybe recently had food poisoning. So doing a lower FODMAP diet really gets those foods that aren't going to produce a lot of gases in the gut. So it just kind of helps to stabilize things, less bloating, less belching, easier to break down foods. There's also the specific carbohydrate diet. I don't prescribe this one as much. It's a little complicated to follow. There is a popular book that kind of spurred a lot of patients to want to learn about this diet. I'm forgetting the name of what the book is called.
Is it something related to GAPS?
I don't think so. I think it has something to do with grains, but it was a popular book about 10 or 15 years ago. Carnivore diet has definitely become more popular as of late. It's a good gut reset because you're really just giving your body really simple proteins to break down. So essentially, it's kind of like a keto diet where we're doing a lot of protein, meat, etc. But again, you're not doing really any fruits and vegetables, grains, dairy products, etc. So very high protein meals, easy on the gut, allows things to reset and resets bacteria.
Is that not it?
Mhm.
I disagree.
So the next one would be low sulfur diet. So this is one that we usually use with different types of SIBO, most specifically hydrogen sulfide SIBO. So we're thinking about excluding things from the diet like any of our brassica vegetables. So things like cabbage, broccoli, kale, mustard greens, those are all very high sulfur, garlic, onions as well. Next, when we get into like cardiovascular conditions or metabolic disease, that is the book Breaking the Vicious Cycle. Thank you. Prediabetes, heart disease, high cholesterol, we typically think of the Mediterranean diet. So this is one that's been around for a while. It has a lot of good clinical research. So it's mostly focusing on lean meats, dairy products, your healthy oils, things like olive oils, coconut oils, avocado oils, plenty of healthy omega-3 fatty acids from fish, and a lot of fruits and vegetables. So it is, very similar to an anti-inflammatory diet, but a little bit more of a specific focus. When we think about high blood pressure or hypertension, we talk about the DASH diet a bit. This is mostly restricting sodium. So it's kind of like a Mediterranean diet, but the focus is more on sodium restriction. So it's important to keep in mind too that not all high blood pressure responds to a low sodium diet. There are different causes of blood pressure, so we want to make sure we understand why the blood pressure is raised, because a low salt or restricted salt diet may or may not affect that. And then we just got some other condition-specific diets for mast cell activation syndrome or a lot of allergic type activity in the body. Sometimes we'll do a low histamine diet. Foods that are high in histamine tend to be things that are fermented, so like aged cheeses, alcohol, probiotic foods, etc. A low purine diet can be used in gout, so things that are high in purines are typically protein sources like meat and fish. And then occasionally for things like herpes or any of the herpes family viruses, we will avoid foods that are high in arginine, which are things like nuts and chocolate. This is just kind of an example of the autoimmune paleo. It's called AIP diet. So you can see the things that are included and the things that are excluded. So I talked about like nuts, seeds, grains, nightshades. So just kind of the more inflammatory foods are things that are avoided on that diet to help manage autoimmunity. So when we think about fruits and vegetables, why do we have so many diets that place a heavy emphasis on this? This is really our main source of antioxidants and micronutrients. When we say micronutrients, we're meaning things like vitamins and minerals. So things like zinc, iron, B vitamins, vitamin C, all of that is mostly coming from fruits and vegetables. And a lot of that has to do with the microbiome of the soil that things are grown in. Hence why trying to get local produce, being part of a CSA, supporting local farms is a good idea because you're likely getting a better soil environment that the vegetables were grown in. Second major thing is these are our main sources of fiber. Fiber is going to do a lot of things in the body that we need on a daily basis. So it's going to help to bind and excrete excess cholesterol from the system. It's going to help all of your detoxification pathways and systems. It's also going to aid hormone function. So if we have excess hormones, if we're getting things from environment that are disrupting the endocrine system, fiber in the gut is what's going to help bind those toxins, those excess hormones, and get them out of the body. Also, fruits and vegetables are extremely anti-inflammatory. They have that antioxidant activity. They can quell free radicals in the body and help to lower inflammation. If you don't eat a lot of vegetables, a really good way to just try to visualize, what even should I be getting in terms of a serving is thinking about like a glass or a plastic measuring cup that you have at home, you probably use for baking or recipes. Trying to really get at least 1 to 2 cups in a day. So if you really don't have any vegetables in your diet at all, you just don't like them or you don't ever make them, I would start with trying to visualize that 1 cup. Can I at least get that much? And then working up to 2. Organic is really best. You want to be mindful of the Dirty Dozen if you're not able to shop organic. So the Dirty Dozen can be found on the Environmental Working Group page. And this is just a rotation of 12 of the most commonly sprayed crops. So the crops that have been in the rotation for the most pesticide use, and to avoid those things or buy organic, and everything else is usually safe enough to buy conventional. I just put in some sneaky ways to increase fruit and vegetable content because this is often where I see patients struggling is they may be getting really low servings of fruit and vegetables and they just really don't know how to increase that or thinking that they need to, add a boatload of servings when it really doesn't have to be that difficult. So some things that are helpful to do are, especially to get extra fiber, adding about 1 to 2 tablespoons of ground flax seeds into meals while cooking. That's going to mix in really well. It doesn't really have a flavor. It's very easy to mask. Another thing that I love to do is making just a really nice nutrient-dense fresh sauce. So I'll make a sauce with either a bunch of fresh cilantro, parsley, any type of greens. If things are going old in the fridge, that can all be blended up and used. So I usually add a bunch of the greens to a high-powered blender. I'll add a clove of garlic, about a tablespoon or so of olive oil, 1 to 2 teaspoons of balsamic vinegar, a little bit of salt, a few ounces of water, blend all of that up. And you have a really nice, tangy, nutrient-dense condiment. Really goes well with anything. We use it often if we're making tacos or a rice dish or anything else to just kind of add over the top. Good way to sneak in greens and herbs and spices. Other things would be adding in chopped or dried fruit to marinades or ground meats. If you are trying to get more greens in, really easy to just add those into a stir fry or whatever you're cooking near the end, just so they're integrated and they're wilted a little bit, but they're not overcooked and we're still getting a lot of that nutrient density. Then I've just kind of put some swapping processed snacks for a serving of fruit or vegetables. Because I find often in patients' diets where they're kind of getting the most processed things is when they're reaching for snacks. So switching those things out can be helpful. I want to talk a little bit about protein because something that I definitely notice is that most of our patients, particularly women, are not getting enough protein daily. I see a lot of under eating, especially protein fiber. Goals, especially for healthy hormone function, if you're thinking about, wanting to have a family or you're moving into perimenopause or menopause and things are kind of up, down all over the place. 20 to 30 grams per meal is a good place to start. I find that often that's hard for patients to incorporate at every meal. So I tell them just try to start with 30 grams in the morning. Can we really bulk up that breakfast so it can last you the rest of the day instead of being hungry again in an hour? If you're someone who tends to exercise a lot, is doing training, you're working more towards muscle mass maintenance, really thinking more 30 grams per meal. So that's more 90 to 100 grams per day and could be even more depending on the person's weight. Importance, having a stable protein source is definitely going to help to stabilize blood sugars. So this is going to help things downstream like the development of prediabetes or metabolic disease. Um, if we're just kind of having snacks all day that are more focused on carb or sugar or starch, blood sugar is kind of doing this. If we add in protein, fat, fiber, things are much more stable. Going to help build muscle mass as well. And again, the breakdown products of protein are amino acids we need for almost every chemical reaction in the body. Just some quick protein sources, things that we might forget about or not eat a lot of. If we're trying to build muscle and we're using things like protein powders, or we find that that's an easy meal replacement, just making sure that they don't have crazy additives, a lot of sugar, things that you can't pronounce. So for fiber, typically, again, something that I see patients underutilizing. This is kind of like first round treatment for high cholesterol. Like I was talking about before, the more fiber we have in our diet, the more that there's our gut is going to be able to bind excess cholesterol and excrete it from the body. So a general goal for healthy cholesterol maintenance is about 25 grams of fiber daily. So we think about things like fruits and vegetables with their skins. So for example, an apple with a skin on is going to have a lot more fiber than a banana, about twice as much. Beans and legumes, our cruciferous vegetables, have a lot of fiber in them. Cooked grains, so things like barley, quinoa, whole wheat pasta, those are going to have a lot more fiber than things like a whole wheat bread or a white bread. And then nuts and seeds. I just put a link to a Mayo Clinic chart. It has a lot of good resources on fiber content for common foods. And I'm going to pass it over to Dr. Paul.
So I'm going to talk briefly about healthy fats. So it seems as though we go through some different fads where different types of foods get villainized, and we're kind of working our way out of villainizing fats. So as long as it's high quality fats, they can create a more anti-inflammatory process in the body. Also, they will not be adding to hypercholesterol and other cardiovascular issues because the fats themselves will be more anti-inflammatory. So some of the foods, some of the fats that are especially healthy would be considered some organic, unrefined, cold-pressed olive oil, also avocado oil, coconut oil, sunflower in moderation, grass-fed ghee or butter, hemp seed oil, and even primrose oil. Of course, the fats to avoid are our fried foods, our hydrogenated vegetable oils, commercial oils, margarine, other processed heated oils, because as you can imagine, those fats going under high heat become denatured, their bonds change, and they become more inflammatory and become more toxic to the body. So when those are ingested in the body really can't identify those and process them appropriately. So a little tip for higher heat cooking, such as over 350 degrees, it's best with organic coconut oil or avocado oil. And then for lower heat cooking, which I use a lot of olive oil, you try to do that below 350 degrees. Now, sometimes when you're cooking with these oils, you can see, if you have it in a pan or if you're baking at certain heats, you will notice more smoking. And if you see smoke, that means the oil itself is burning. So you need to consider other types of fats for that type of cooking, or reduce your temperature and find other ways to cook. Another little tip, sometimes it's helpful to add these healthy fats like olive oil after you're done cooking. So let's say you steamed your vegetables, you take them out, you can add salt, a little bit of lemon and oil to them. The oil is not heated whatsoever, so it's in its closest natural state, and that would be great for your body. What about processed foods? So guidance to go by. So as you know, it's impossible to avoid. Sometimes on our daily habits, whether that's related to work or school or having kids or family, we do need to reach for processed foods from time to time, and that's okay. All of this stuff that we're talking about today is progress, not perfection. So some people like to use different rules, like the 80-20 rule, the 90-10 rule. Um, Try to focus on 80-90% of your diet to be more whole foods. That doesn't mean you can't ever have processed foods, but a large portion of your diet and also your plate really should be more whole foods, fruits, vegetables, grains, meats, and fats. The issue with processed foods is the stuff that comes with it. So oftentimes are the additives that are added to it, like high fructose corn syrup, brown rice syrup, other artificial flavors and sweeteners. They confuse the body, they especially confuse a lot of your insulin receptors and also overload your liver, which creates fatty liver. So when the body has excess sugar, in whatever form, even high fructose corn syrup, if it can't use that sugar in form of glucose, when it gets to the liver, it turns it to fat to store it. So sometimes certain weight gain is related to excessive sugar intake, and also certain fatty liver is related to excessive sugar as well. One good rule is when you're looking at something to buy, try to find a processed food that has the least amount of ingredients. You also can learn to find which ones have added sugars. It will tell you how many total sugars. You also get in the habit of looking at if it says like cane sugar or high fructose corn syrup, and you can avoid it. Also, if you can't pronounce what is that in those ingredient lists, then you probably shouldn't eat it. All of this, you're trying to avoid large amounts of added sugars, the trans fats, and the preservatives that can be more harsh on the body. So here are some tips for better digestion. So yes, it matters what you eat, but also it really matters how you eat, perhaps just as much. So with all of these things, try to add one or two per week, and maybe over time they become more of a habit for you. So first, chew thoroughly. So properly breaking down food is really important for digestion. It begins in the mouth, that you properly break down the food. Also, if you're chewing and it stays in your mouth for a while, there are some digestive enzymes that are secreted in your mouth to help break things down. So by giving the food adequate amount of time and breaking down appropriately in your mouth, it won't be overwhelming the stomach. If it's not overwhelming the stomach, it won't overwhelm the intestines. It's kind of a top-down approach. So really focus on chewing thoroughly. Also, avoid watching TV's movies during a meal that are too stimulating for several reasons. Well, one, if you're watching something that's very stimulating, you're actually in a more parasympathetic state where you are running from the bear. Now, can you imagine running from the bear and properly digesting your food? You really can't. So it's great if you can just rest, digest, not focus on a particular movie. Make sure your conversation isn't too riveting with your loved ones, but try to put yourself in a parasympathetic state so you are secreting the right digestive enzymes. It's supporting proper smooth muscle contraction in your intestines and gives your body the attention it needs on the food and the process you're doing at that time. Also, you notice if you are watching something, you're not really paying attention to the food, you're not really focusing on how properly you're chewing, you also then realize your food is kind of gone, just like that. So if you're not giving any attention to food, there's no way your digestive organs are also giving attention to your food. Another good way to support parasympathetic activation is to take deeper breaths. So diaphragm breaths are breaths along the abdomen. The diaphragm is right at the bottom of your lungs. Focusing on that area really stimulates your vagus nerve for digestion. So take a few deep breaths before you begin a meal. Also take some good breaths while you're eating the meal. It's also very helpful to avoid drinking beverages in general with meals because it dilutes your stomach acid, but also carbonated beverages can sometimes add to increase in belching and burping, which adds to further indigestion. Now, having further indigestion and more diluted stomach acid means you're not breaking down and digesting your food appropriately, so you're absorbing less of the nutrients that you're eating as well. Back to chewing thoroughly, just slow down. Oftentimes we're eating way too fast. Let's think about the Europeans. Now they spend 2-3 hours with meals with friends and loved ones. Take your time, enjoy your food. Most likely you put a lot of time and energy into it, so give it the attention it deserves. One really good thing for balancing your blood sugar is go for walks after meals. So go for a 5 to 10 minute walk, could be longer after a meal, and that stimulates digestion. So it helps the movement of food and also stool through your digestive tract. But also the act of walking is activating muscles and they want glucose. So it helps with people who are pre-diabetics or diabetics because it pulls actually some glucose out of the blood into the muscles and can stabilize your blood sugar. And then finally, don't forget your body is very wise, especially if you're listening to it. So if you are slowing down, if you're not distracted by other things, your body will give you signals of whether you're full, whether you don't like this food, whether something's upsetting your stomach, and then you can learn, okay, I've eaten enough, I can stop. I've learned this food does not sit well in my stomach. Maybe I have a sensitivity to it, and so forth. So your body has a lot of innate wisdom it can share with you. I'm going to give this back to Dr. Mele. She can talk about it.
So just some basic tips for changing your diet. You want to make sure that you give yourself some kindness with this because it's very difficult. Most of us have patterns that we picked up from our families. It's really hard to integrate change. So I find starting with small goals is going to be easiest. So typically I'm going to start by adding things into the diet rather than eliminating. It can feel very anxiety provoking or shocking or distressing to start taking out a bunch of foods. I'd rather patients add things in. So for example, if they're kind of low on that fruit veggie intake, can we just try adding in an extra serving of vegetables at lunch or to dinner or to what you're already eating? So starting small by adding something in. A lot of times adding some herb spices that you already like to any new foods you are trying can help as well, especially if you're trying to add in more vegetables, etc. You're maybe trying some new sources of fiber, etc. Putting some marinades, herbs, spices, sauces that you enjoy can help with that. Definitely start taking a look at cooking oils you're using. Dr. Paul kind of mentioned those healthy fats and things that we want to use. Seed oils like what we were talking about, canola, the hydrogenated oils, etc., are extremely anti-inflammatory. So a lot of those have also really high caloric value. So if you're trying to lose weight, you're not really sure what's going on, I would definitely start to take a look at those cooking oils you're using. And then also if you're eating processed foods, are things like that in there, canola oil, other seed oils, etc.
I just want to interject. You said anti-inflammatory. They're inflammatory.
Yeah.
Yeah.
So we want to focus on one meal per day to change. Sometimes that can be a little bit easier as well than thinking, I need to disrupt the whole system. Usually a change that I see patients be able to stick with and really notice it makes a difference in their daily energy levels if they focus on a high protein and balanced breakfast. So they get that 20 to 30 grams of protein, they have some fiber, they have some fat, they're maybe getting in some fruits and vegetables that they find that that's carrying them a lot throughout their day. They're not as hungry when they reach lunch. They have better energy in the morning, especially if that's been a more difficult time for them. A lot of times too, sometimes if we just start to change the snack options to some fruit, vegetable, fiber, protein combinations. Again, like I was saying earlier, usually when I see the processed food sneak in is during snacks or we're at work and we're just kind of reaching for something. It can also kind of be telling to keep a food diary for a week. Not only to see calorie intake if you're trying to lose weight, but just trying to understand, what are your dietary patterns? How many vegetables and fruits are you eating? What do your protein sources look like? It's also really helpful if you're having a lot of digestive symptoms. Just kind of catalog what you're eating for a week and then write down, if you had nausea that day or you had a loose bowel movement that day. It can be really helpful. A few other things. Sometimes if we do an eliminative diet based on symptoms or we're just kind of wanting to try it, a lot of times I see some food fear come up when reintroducing foods you haven't had a part of your diet in a while. If we don't work on that, the body is going to hold that as well, and that might promote poor digestion of that food or an immune response. Your thoughts are your body, and both of those are communicating together at all times. So maybe doing some journaling around that, mindfulness exercises, so that we can be in a calm and relaxed state when we introduce those foods. Trying to look to blogs for inspiration, books, online recipes to try to get some new ideas for how to incorporate things, or if it's something that you don't know how to cook or try. Also, finding ways to make cultural foods of significance more healthy. So I don't like telling patients that they can't have foods that are significant culturally to them, but maybe we can change things up a little bit. Can we change a sauce to make it a little bit more health friendly? Can we add more fiber, protein, swap the vegetables, remove processed grains, etc.? And I'll give it back to Dr. Paul, and I'm going to grab a charger.
So I just want to speak briefly about intermittent fasting. So it's becoming pretty popular and prevalent. People are talking about it. So what actually is intermittent fasting? It basically means avoid eating. Now you can disrupt your eating cycle if you think you're not eating food, but you're actually having foods with sweeteners and sugars in it. So if you want to do a true fast, it's with water or tea without additives and sugars. As far as intermittent fasting, that's when you try to condense all of your meals into a certain period of time during the day. So some people restrict their food to 10-hour window per day. Some people do 8, some people do 6. I try to do more of a 10. That means where you might have your first meal at 8, your lunch at 1, and also your dinner at 6, and then no food afterwards. So the intermittent fast technically is from 6 p.m. to 8 a.m. the next day, but also it be considered little fasts in between those meals. So in addition to the fasting, I think it's best to try to stick to just 3 meals per day and also limit your snacking to 1 time per day. So whether that's between breakfast and lunch or lunch and dinner. Now, why do we do this? So some of the health benefits, it allows your digestive tract to clean house. So I'm sure you've been hungry before and you feel your stomach grumbling. It's somewhat painful, it's somewhat distracting, it's very loud. That's actually your smooth muscle contracting and also your stomach contracting to clear waste. So it's clearing excess food that's still lingering, other cellular waste from your digestive tract, and that's really helpful to allow your gut to clear out. This is especially helpful for conditions like SIBO, or other dysbiosis or abnormal gut microbiome that allows them to kind of reset during that time. So it's nice to have that break in between meals. Otherwise, if you're just eating all the time, your body never has a chance to fully clean. Also, during the times where you're fasting, your body starts pulling, or your insulin receptors feel like they're not going to get any glucose anymore. So it'll sensitize your insulin receptors to pick up on glucose better. So it's really helpful for our diabetics or pre-diabetics to decrease their insulin resistance and sensitize those insulin receptors. And then finally, it allows the body the time and energy it needs to focus away from digestion to other biochemical processes. Another question that we get a lot is, what about vegan diets? So in Dr. Mele and my experience clinically, we don't see very good consistent results with vegan diets. So we oftentimes see patients who have been on vegan diets for a certain period of time, whether that's months to years, and we start seeing signs of being malnourished. they suffer from fatigue, their skin conditions, and then hormonal imbalance. Likely that's because they're not getting the appropriate fats. So, and there's also an issue that some vegans that then tend to reach for some processed vegan foods or meat-like products, which are full of preservatives and artificial flavorings that are even worse for the body. Now, I will say, and we will say together, that we fully support everyone to find the right diet for themselves. And there are some people where vegan diets, it works well for them. But it really isn't a majority of people that we see. I think genetically, I think based on blood type, I think based on what type of vegan diet they're able to do, whether it's healthy and balanced, there's certain reasons why some people can tolerate a vegan diet really well. And those are the ones that write the books and they run marathons and they're just running on vegan foods. So finding the right diet that works for you is important. Also, we fully understand and we're aware of the effects that commercial farming, especially meat agriculture, has on the planet and also on the ozone and with climate change. So I think certain organic, more regenerative farming processes, even if they do include animal meat, can be done in the right way, but we're just not there yet. So I understand the reasons to not only protect the environment and also protect the animals. So we're sensitive to that, so we understand if vegan diet suits you better. But if you're not feeling well on the diet, I would strongly consider consulting with one of us on how to add back in the right foods. And so finally, we're just going to end with a Q&A. If there's any questions that you'd like to ask us, or you want to give us a topic discussion for our next webinar, we're open to your suggestions of what information would you like to hear from us about. If you have questions later, you can always give us a call or send us an email as well.